All right, my name's Sarah Buckley. This is the thoracic, lungs, cardiac, and peripheral vascular video assessment for this week. This is my patient Alec. Alec, do you consent to have this assessment done and recorded?
Yes.
All right. All right, I'm going to start washing my hands. All right, Alec, I'm Sarah. I'm the nurse practitioner that's going to be doing your assessment today. I'm going to start by listening to your lungs, so if you don't mind taking your shirt off for me.
No problem.
And just sit up straight and just take a nice couple of deep breaths. I'm just looking at the rate of your breathing, the symmetry of your chest as you breathe. You're not using any accessory muscles. You look very comfortable as you breathe. All right, so if you could just turn around for me for the purpose of the video. I'm just going to have Alec turn around so you can see the assessment as I do it on the posterior side of his back. All right, so let's look first, Alec. I'm just going to inspect your back. All right. If you could just take a couple of deep breaths for me. Do you have any tenderness or pain while I'm palpating your back?
No.
And I don't feel any fremitus. I'm just going to percuss your back as well. Just going to try to find your diaphragm. Next, I'm going to actually listen to your lungs. We take a next couple of deep breaths. And while I have you facing that way, I just want you to keep on saying E, 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 E until I tell you to stop.
E, 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 E.
All right. Now I want you to say 99 and just keep on repeating it again.
99, 99, 99.
All right. And lastly, I just want you to whisper 1, 2, 3 and keep on doing that. All right, Alec, you can turn back around. And we're going to do the same thing on the front of your chest. So I'm just going to feel around first. Any tenderness? Good. And take some deep breaths for me. I'm going to percuss your lungs again. I'm going to listen to them. Right, and same thing again, the E first.
E, 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 sorry, E, 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 E,
All right, now the 9-9.
9-9, 9-9, 9-9, 9-9, 9-9, 9-9, 9-9, 9-9, 9-9, 9-9, 9-9.
And then the whispering. All right, good. All right, Alec, next we're going to do your cardiac system so you can lie back on the pillows. All right. First, I'm just going to take, can you move up a little more?
Sorry.
Yep, just like that. Perfect. All right, so I'm just going to start by just looking at your jugular vein and your carotids. I can see your carotids pulsating. I'm just going to first palpate them. Or actually, I'm going to listen for bruits first. So I'm just going to put my stethoscope right where your carotids are. And just, I want you to take a deep breath and then hold it for me. Okay, and release. And then on the other side, the same. Deep breath. Okay. Thank you. All right, I'm going to just palpate your carotid pulse. Just do one at a time. I can feel it's nice and strong. And on this side. And I can feel that one as well. All right, I'm just going to palpate your chest as well. Any tenderness?
No.
Or pain?
No.
I don't feel any crepitus. All right, Alec. I'm just going to try to palpate your apical pulse. It's in the 5th intercostal space. I can feel that as well. Alec, I'm going to listen to your heart. I'm going to be doing different positions on your body, but you just stay nice and still, and I'll have you move in just a second. I'm going to listen to aortic, pulmonic, tricuspid, Erb's point, and the mitral valve. And I can hear S1 and S2. Strong, regular rhythm. I don't hear any murmurs or extra sounds. Mitral. And for me to hear this better, Alec, I'm going to have you turn on that side towards the left, your whole body. Yeah, thank you. This is the lateral decubitus position. It assesses for mitral stenosis, but I do not hear that. You can turn back onto your back and then sit on the side of the bed again. And I'm just going to assess for any aortic regurgitation. So I want you to sit up, face forward, and then I want you to lean a little bit forward. Perfect. All right, exhale completely. Take a nice deep breath in. Exhale completely, and then hold your breath. All right, now we're going to do your vascular system. If I could just see your wrist on this side. I'm just going to palpate for your arterial pulse, which is actually a 3+ bounding. And then I'm also going to palpate your brachial. I'm going to do that also on this arm. I'm going to try to palpate the epitrochlear nodes, which are right here. They can be difficult to find, which is normal. And while I'm here, I'm going to also palpate for some axillary nodes, lymph nodes. And this arm. Now, look, we're going to do what's called an Allen's test. I want you to put this arm out and put a fist. Okay, I'm going to occlude both your radial and ulnar veins. I'm going to release one, and when I release it, I want you to open your hand up, okay?
Mm-hmm.
All right, so I'm going to let go of the ulnar. Now open. Good. And your color of your hand returned to normal. We'll give it a second, and then we're going to do it the other way.
Okay.
Make a fist. All right, and now I'm going to let go of the radial. Open. Good. Return to normal. And we'll do it on this side for safe measure. All right. Okay. Good. All right. I'm going to have you lie down again.
How far up? Up.
Same as you were. Okay. I'm going to try to palpate your abdominal aorta. I'm sorry if this is uncomfortable. Okay. I'm going to palpate your inguinal lymph nodes. So if you could just pull your pants just to about here for me. Perfect. That's good. Feel those. All right, now I'm going to try to find a feel for your femoral pulses. All right, you can pull your pants back up, Alec. Do you have shorts on underneath?
I do.
Could you take your sweatpants off for me, please? I'm going to try to feel for your popliteal pulses, which are located behind your knee. So if you could just leave that one down. This one, yep. Okay. And then the other one. Make sure that my camera can see. Okay. And then I'm going to feel for your dorsalis pedis pulses. And then your posterior tibial pulses as well. All right, I'm going to see if you have any edema in your legs. Both of your feet look symmetric. You feel warm. You have good cap refill. I'm just going to see if you have any edema in your legs. Prednisone really helps.
80 milligrams a day.
All right, I don't see any edema. All right, and that's our full assessment.
Thank you.
You're welcome.